pretty good. We're in the video.
Yeah.
Good. Okay, so we're right on scene now. We're just going to do a quick ethane report. So the exact location is the lounge room of an apartment. Type of incident is a cardiac arrest. Hazard present is, other than a bit of clutter, nil. Access to the patient will be via the front door. The number of patients is currently 1. And emergency services on scene is paramedics, and there is 4 of us because we're about to operate as a pit crew. We're going to utilise standard precautions with glasses and gloves, which we both have on at the moment, which is great. The scene is safe. There's no dire dangers that could potentially harm both my partner and I. We're all good and safe to go. So I'm just going to go through AVPU to see whether the patient is alert. Hello, can you hear me? There is no verbal stimuli. They're not responding to verbal stimuli. Hello, can you hear me? They're not responding to painful stimuli either, so they are unresponsive. I'm just going to go through a primary survey, just going through AVCs. I don't see any catastrophic hemorrhages or anything like that, so go through A. So I'm just going to utilise a head tilt chin lift to see whether the airway is clear, keeping in mind C-spine precautions. Airway looks to be clear. I'm just going to check the breathing. So I'm listening and looking for chest rise. And then I'm also checking the pulse. You're going to check the pulse for about 5 to 10 seconds to ensure that they're not bradycardic, so there is no pulse. So there is no signs of life and there's no reason to not commence resuscitation, so rigor mortis or anything like that. So Taylor, could you please jump on the chest and start CPR? I'm going to call a backup of the highest clinical level available. So, hello, this is Team Paramedic Mad Dogs here. Could you please send some backup of the highest clinical level available? We have a confirmed cardiac arrest. Thank you very much. So I've got all of our gear here set up in 300-degree access. We do have a team. Once backup arrives, we'll have a team. We'll have the pit crew running, so I'll be at the head at the moment. Taylor's on the side. We'll have another paramedic at the side, another one at the feet. Continue compressions. I'm going to turn the life pack on. So turning the life pack on now. Now I'm going to cut the patient's chest. You continue compressions. I'll work around you. So I'm cutting the shirt open. I'm going to clean, shave and abrade the chest and remove any hair that may prevent correct sticking of the pads. I'm going to take the defibrillator pads out of the life pack and attach them where need be. So just inferior to the clavicle on the right hand side and also on the right hand side just below the armpit. So the pads are on. I'm just going to go through the coach procedure now. So continue compressions. Oxygen is away. All else is clear. I'm going to charge the life pack 15 to 200 joules. So charging to 200 joules. Okay, do you see 200 joules?
Yes.
Okay, no worries. I'll just get you to take your hands off for me. Are you safe?
I'm safe.
Okay. We're going to evaluate the rhythm. I see VTAC. Do you see VTAC?
I see VTAC.
Okay, I'm going to shock the patient. You're safe?
I'm safe.
Okay, everything else is clear. So shocking the patient as I watch the patient's body. Bzz. Shock. Okay. There is no signs of life, so if you could please jump back on chest. Thank you. So we're going to look at oxygenating the patient now. So I'm going to start with an OPA as an airway. Do you agree with that?
Yeah.
Okay, great. So we're going to insert an OPA here. Insert an OPA. I'm going to get my oxygen out. Oxygen out. I'm going to start bagging the patient. So do you want to count me down when you get to 30 compressions? Because we're going to 30 to 2.
28, 29, 30.
Great. 2 sharp breaths. Great. Continue compressions. So we're also going to have a look at the reversible causes here, so the 4 H's and 4 T's. So we're addressing hypoxia by oxygenating the patient. Hypothermia, does the patient feel hot or cold to you?
A bit warm.
Bit warm? Okay, no worries. Also hypovolemia, I can't see any catastrophic hemorrhages at all through the patient, or internal bleeding, which we're suspecting. And hypoglycemia, which we're unaware of, but we'll get a set of vitals once backup arrives. Asynchronic ventilating, so I'm just ventilating as Taylor continues compressions. What round are you up to?
3.
3rd round? Okay, no worries. So going through the T, the reversible causes, we have toxins, so I'm looking at any environmental impacts that there might be any drug paraphernalia or medications present. Tension pneumothorax. We're aware of that. Cardiac tamponade is something we can have a look when backup does arrive. And also a thrombosis, which is something that we can't do as P1s at the moment. So we're up to the 4th round?
Yes.
Yep. Okay, so we're just going to go through coached again. So continue compressions. Putting the oxygen away, all else is clear. Going to charge the defibrillator to 200 kilojoules, so charging. Do you say 200 joules?
200 joules.
Okay, no worries. Taylor, hands off for me, please. Are you safe?
I'm safe.
Okay, let's evaluate the rhythm. I see VTAC. Do you see VTAC?
I see VTAC.
Okay, I'm going to shock the patient. You're safe?
I'm safe.
Shocky. Looking down the patient. Okay, great. I don't see any signs of life, so continue your compressions for me. Now, I'm going to come around the side here and I'm going to swap over compressions for you to give you a bit of a break.
Alright.
So I'm going to jump on this side just for the camera. So do you want to count me down?
3, 2, 1.
Okay, great. So I'm just going to jump on chest here. So now we're going to look at removing the OPA and look at a more advanced airway. Also, when the backup arrives, we're going to gain some IV or IO access to administer medication. So we're going to start with adrenaline at 1 milligram now that we've done our second shock. So if you're able to remove the OPA and insert the I-gel for me.
It's been removed and I've got the eye gel. It's going in. Taping it.
Okay, great. And also if you could attach the ETCO2
Sure.
adapter to it. Thank you very much. Just to keep an eye on those numbers. We're aiming for 25 to 35. Alright, I'm up to the second round now. We're just ventilating asynchronously. So just ventilating whilst continuing compressions. We're still considering waiting for backup to arrive. We've administered some adrenaline. We're up to your third round.
Third round.
Yeah. I wonder what caused this cardiac arrest.
Hypothermia.
Hypothermia. Alright, so getting towards the end of the fourth round here. So I'm going to go through coached again, so I'm going to continue compressions. If you could put the oxygen away, please, Taylor.
Sure.
All else is clear. We're safe. If you could charge the defibrillator for me.
Charging.
Can't hear it charging. Alright, so we're at 200 joules.
200 joules.
So hands off, I'm safe. Are you safe?
I'm safe.
Okay, going to evaluate the rhythm. I see a normal sinus. Do you see normal sinus?
I do see normal sinus.
Okay, we're going to conduct a primary survey again. Checking the airway. We have the supraglottic airway in there at the moment. Is the patient breathing? I'm going to listen and feel. Agonal and very light chest out. I'm just going to check for a pulse. Okay, this is ROSC. We'll leave the supraglottic airway in for now, and then if you could just bag the patient at 10 breaths a minute, so every 6 seconds.
Yep.
Okay, great. Thank you. Do you reckon that went alright?